Study designs are broadly classified into observational studies and interventional studies. Interventional studies are conducted to determine the effectiveness and safety of an intervention for a particular health condition in a target population. They include randomized control trials and non randomized trials. In randomized control trials, the researchers recruit a study sample with the health condition. Some of the study participants are given the new intervention or intervention of interest and they form the intervention group. The rest are given a placebo or a standard treatment and they form the control group. The decision regarding which study participant should be allocated to the intervention versus control group is based on a procedure called randomization or random allocation. This is the key feature of this study design. Subsequently, the researchers follow up with the study participants over time to evaluate the improvement and side effects in both groups. By comparing these outcomes, the researchers can determine whether the intervention is more effective and safer than the control. Examples of randomized control trials include evaluating the effectiveness of SMS reminders versus treatment as usual in improving medication adherence in patients with diabetes mellitus. Dexmedetomidine versus saline in improving intubation response in patients undergoing general anesthesia, and motivation enhancement therapy versus treatment as usual in improving the dietary habits of patients with hypertension. Randomized control trial, as described earlier, is the best way to establish the effectiveness and safety of an intervention in a particular health condition. However, in some situations, randomized control trials are not feasible due to practical or ethical constraints. In these situations, the researchers may use non random allocation techniques to decide which study participants should be allocated to the intervention versus control groups. Alternatively, they may compare the outcomes before and after an intervention in the study sample. These studies are described as non randomized trials. Examples include evaluating the change in mental well being of students before and after mindfulness training, and change in the attitude of students towards electroconvulsive therapy before and after an educational intervention. Consider a study in which a group of researchers wanted to evaluate the effectiveness of SMS reminders in improving medication adherence in patients with diabetes mellitus. They recruited 150 patients with diabetes mellitus. After recruitment, the participants were randomly allocated to the SMS group or control group. Those in the SMS group received twice weekly SMS reminders regarding medication adherence, and those in the control group received treatment as usual. They followed up with the patients for 4 weeks. At the end of 4 weeks, they administered standard rating scales to measure medication adherence in both groups and compared the scores between the groups using standard statistical tests. This is an interventional study as the researchers provided SMS reminders as the study intervention for the purpose of the study. Since they used randomization to decide which participants were allocated to the intervention versus the control group, this was described as a randomized controlled trial. Consider another study in which a group of researchers wanted to evaluate the effectiveness of dexmedetomidine on the intubation response in patients undergoing general anesthesia. They recruited 80 patients undergoing general anesthesia using random allocation technique, randomization. They gave dexmedetomidine to one group of patients before giving general anesthesia. This was the intervention group. They gave normal saline placebo to the other group before giving general anesthesia. This was the control group. They recorded the changes in vital parameters during endotracheal intubation in both intervention and control groups. This was considered an interventional study as the researchers provided an intervention, that is, dexmedetomidine versus placebo, for the purpose of the study. Since random allocation was used to decide which patients were allocated to the intervention versus the control group, this was described as a randomized control trial.